Hi, I'm Dr. Deepesh Venkatraman. I'm a consultant interventional cardiologist and I practice in Chennai. I wish to discuss about a very common issue which concerns people with heart issues, that's blockage to the blood supply to the heart. And I want to make it clear that there are two types of blockages that develop in the blood vessels which take glucose and oxygen to the muscles of the heart. One type of blockage is due to cholesterol, and there is a very different type of blockage due to clot formation. And we need to understand the difference between these two type of blockages, because the way they present itself are having very different relevance. So, when we talk about the cholesterol blockage, that is a waxy substance that gets deposited in one of the three vessels or more than one of the three vessels of the heart, coronary arteries which we call. These blockages develop over years. They may start developing right when you are 10 or 15 years of age, and then progress on. For few people who are genetically predisposed, they develop within few decades, that is by their 30s or 40s, and some people who are otherwise living a very healthy lifestyle and are having a very good genes, they even develop these blockages at 70s and 80s. But the main feature about these blockages are that they develop slowly, and the way they present itself is when somebody starts walking and they are in a regular habit of walking, they feel a compressive or a heaviness in their chest, and the walking speed or walking distance comes down over a period of months, and that's when they should get alarmed and they should get themselves checked. This checking should definitely involve a test called treadmill test, because that's the test where they check the heart during walking and exertion, and that can detect blockages at a much earlier stage, and that's the stage when we want to get diagnosed and correct it with even medical management. So, this is something that I want to share about the cholesterol blockage. But there is a different type of blockage which people get confused about, which is a blockage due to the clot formation. And regarding this clot formation, clotting is a mechanism of healing for any injury in the body, and in the same way, if the blood vessels inside the heart suffers an injury, it can attract a clot formation. Sometimes these clots are small and doesn't even give any clinical symptoms, and sometimes if the injury is big and the clot size is big, it can in fact completely obstruct the blood supply to the heart, and such patients develop sudden chest heaviness radiating to the jaw, the neck or the arm, associated with fatigue and sweating, and this presents like within few minutes to hours, incapacitates patients, and these are often due to response to stress, be it emotional or physical, and they are very sudden. So, the person might have gone for a good amount of play the day before without any symptom, and the next day he develops a sudden chest pain, and patients come and ask us, he was fine till a few hours or one day before, and how has he developed it so suddenly. So, these clot related blockages always happen suddenly over few hours, and the most important thing to know about these clot blockages is that it has to be addressed very quickly. It has to be addressed within the first 1 hour, which we call as the golden hour, where we can save most of the muscles. That means when you open these vessels within that 1 hour, you are likely to go back home with the complete capacity and efficiency of the heart function. If you delay it by say few hours or 1 or 2 days, then what we end up having is a weak heart. So, even though we survive, we end up having something called heart failure symptoms, that is breathlessness on walking, and our exercise capacity comes down. So, one is central chest pain associated with sweating, which makes you not able to walk and all, should be immediately taken to a hospital where or a clinic where availability of ECG and echocardiography and a blood test called troponin is available, so that it can be diagnosed. And these are patients whom, once they undergo an angiography, should agree for an angioplasty on the table. So, there is a misconception that we were not allowed to go for a second opinion, but heart attacks are emergencies. If you want to come out of it in a very safe fashion, you should probably follow the instructions of an interventional cardiologist and consider it as an emergency and go for these stenting procedures at a same sitting. While the blockages due to cholesterol and sometimes due to treadmill positivity, when you undergo an angiography, you may take time, you may reconsider your options and then go for an angiography in an elective fashion. So, I wish my audience and patients understand this difference between the cholesterol blockage and the clot blockage and the actions that they need to take in case of such blockages being detected.